Welcome back. You are listening to Ron Greenwald, host of San Diego Spotlight on ESPN 1700. In our studio today, we have our special guest, Dr. Ferrer, who runs and the founder of Vasectomy Clinic of San Diego, located in Encinitas, California. VasectomyClinicSanDiego.com, VasectomyClinicSanDiego.com. And for those that missed the first segment of our show, I want you to know if you are considering, planning, anticipating in any way, shape, or form a vasectomy, there are whole new things you need to be aware of that is going to make it, I wouldn't say something you're going to totally look forward to, but it's a lot less than it used to. There's no more needles. Is that right, Doc?
Correct. No more needles.
No more needles, no scalpel vasectomy. You're in on Friday, and you're whether you want to go back to work on Monday that's I guess up to you. You can always tell the boss, hey, I just had a vasectomy and I'm taking another day off. But it looks like it's like everything else in medicine. There's new innovation day in and day out that you're taking advantage of and helping people get back to work and avoiding having unwanted pregnancies.
That's correct.
And again, we'll just tell us a little bit about, I understand you have a military discount.
We do. We do provide 10% discount to all military personnel.
So again, being in San Diego, we know there's a lot of listeners here that are involved, active military personnel.
Correct.
And if they were to call, I mean, is there a lead time to when they would be able to get the procedure, or what type of lead time?
Well, there's no waiting periods, but so if they want a vasectomy the next week or any Friday or Saturday, we're more than welcome to pencil them in.
So, I mean, if the husband and wife, they call you for an appointment, would that be Monday, Tuesday, or Monday, Tuesday, when? Or what type
Typically,
of time?
I see them on Fridays or Saturdays. We're able to do a consultation before the procedure, which a lot of people do. They come meet,
Meet and greet.
the doctor, because, obviously it's a sensitive procedure. So if they click with the doctor, then we can schedule them the following week, or we can just do it right there.
Okay, so it could be that same day.
It could be that same day.
Yes. And do you recommend they bring someone to drive them home, or can they literally drive back home?
I do recommend someone to drive, but I have a lot of male patients that just come in by themselves, and they drive themselves home without any problems. I haven't had any problems.
You haven't heard of any issues?
No, not at all.
With that one. Well, come on, guys, have a girlfriend, your wife, somebody. At least you can. Whether it does, assuming it does, it's fantastic, and it's as painless as it can be. You still want to soak up the sorrow from the misses a little.
Some
bit.
support. There.
Some support, so things like that. And what about insurance and cost? What should somebody expect when they come and see you and get the vasectomy done?
Right. Well, the cost of the vasectomy is the lowest in the country. One of the lowest in the country, certainly in the state. And we only charge $600 for the procedure. But we also take insurance. We take United Healthcare, Cigna, and Blue Shield.
Is it generally covered by?
It is generally covered by insurance, by most insurances. However, it's kind of tricky sometimes, and patients need to be aware of if they have fulfilled their deductible, and they need to find out if they have a copay, and so it can be a little bit tricky. The best thing to do is to call their insurance and ask.
And is that something you have a staff that can help them on in terms of filling out the paperwork, or is that something you kind of rely on them to do on their?
Well, all they have to do is either fax us their insurance card, and we do everything else for them.
Okay, so you'll take care of that.
We do take care of that. They don't have to fill anything out.
Okay, so again, Vasectomy Clinic of San Diego, VasectomyClinicSanDiego.com, and the phone number is 760-436-8700. And you have a FAQ on your website,
I do.
So it answers a lot of the questions. So again, let's talk about when I can start playing sports or exercising. What would you recommend on that one?
I would say Monday. I would say the
Monday?
following Monday.
I don't want to do that. I want to rest.
So if you have your procedure on Friday or Saturday, you can resume, a normal, exercise. You can jog if you like. I do provide every patient with a athletic supporter or a jog strap, and I do recommend they use that for that first week while they do exercise. If the exercise is a little bit too much for them, they feel some pressure down there, I do recommend backing off and resting.
Okay, so then you have the scrotal support.
I do, yes.
And again, one of the very important parts of this is the 12 weeks after. Let's tell everybody what to expect.
Yes, that is very important. A lot of men don't know this, and that's why it's a good idea to have the consultation and or go through my website. It should be clearly written in there. So the 12 weeks is to allow the sperm to be reabsorbed and to expel it all. In the past, it was stated to do certain amount of ejaculations, but now the new recommendation is just waiting for 3 months. The lifespan of a sperm cell is about 3 months, and after 3 months, they start to swim funny, and then the body just reabsorbs them nicely. So basically, we're just waiting them out for them to be reabsorbed.
If somebody can wait the 3 months,
Exactly.
then you're home free. And do you do it? Do they come back to you for any type of testing, or?
Of course, yeah. So in 3 months, they come back. They bring their little sample. I look at it under the microscope and call them and give them the thumbs up to go ahead.
To have a good time.
Exactly.
For
Yeah.
go on a vacation and without the children.
Don't worry about anything else. Yes.
So I understand you've got 2 little small ones. Tell us about your family.
I do. Yes, I have twin girls. They're 2.5 years old, and they're a handful.
Yeah. So when's number 3 coming?
I don't think
No,
we're gonna have any more.
You're gonna hold steady at
We're
2.
gonna hold steady. Yeah.
Oh, that's
It's
fantastic.
too much work. Too stressful.
Yeah, for those he has 2.5 year. Ferrer has 2.5 year old. And I was telling him, well, wait, because the teenage world is coming in about 10 years. If the debate is who has the easier time of this, or where there's less risk of down the road, you would say the male.
I would say the male is the easiest. And as you know, there's a lot of birth control pills out there. There's none of these medications are without side effects. You have weight gain, you have blood clots, etc., etc. So the vasectomy is the most effective, least amount of side effects, if at all.
I mean, the vasectomy procedure has been going on for, I don't know how many. I mean, how long does it go? How far does it go back? I mean,
decades and
decades.
Even I don't know.
So you never have heard of any studies of bad side effects to I mean, I've never heard of it or even read about any side effects to a vasectomy 20, 30 years down the road.
Well, there was a recent study that showed that vasectomy can potentially cause prostate cancer. But and this is a very recent study. But in the past, these rumors were put to rest. But once again, there was another study done recently that it could potentially. Now we have to be a little bit more.
Everything's potential.
Yeah, we have to be a little bit more careful with the results of these studies, because are we gonna push the responsibility to the woman, to the female, to the wives, to do the birth control? So we have to wait and see if these results are truly accurate.
Yeah, I mean, I was actually doing some research before we came on the air, and there's Cornell University has a very positive study on the no needle, no scalpel vasectomy in Cornell, you kind of
Correct.
think they know what they're talking about. So, I mean, that would make sense if it was 1975, the Chinese population, back, they've been trying to do things to control the population of China for a lot of years. So maybe
Correct.
was kind of some research that was done there.
That's correct.
So do you see things in the future that are even going to take it beyond where we are now, or what do you see for the future?
I think, with medicine, everything is evolving, and it's slow to evolve. There's been other suggested procedures, techniques, but for now, this is what we have.
So this is the state of the art.
Correct. The gold standard for now.
The Vasectomy Clinic of San Diego, and again, the website is vasectomyclinicsandiego.com. Dr. Ferrer, and it's 760-436-8700. His offices are on El Camino Real in Encinitas. I know it very, very well. It's that famous brick. There's 3 brick buildings. You can't miss them. Pretty close to Home Depot.
That's correct.
I know it very well.
Very
So
good.
if you're coming off of Acadia Boulevard, or you're coming off of Encinitas Boulevard, stop on in, get your vasectomy on the way home on Friday afternoon, and back to work on Monday without feeling sorry for yourself or anything like that. And that way you can have a great sex life afterwards and not have any inhibition and not worry about having any more children. So with that said, so you're going to call him today, by the way. With that said, we're going to take a very brief commercial timeout, and we'll come back with Dr. Ferrer in the third segment of this, and we'll learn more about getting your vasectomy done as soon as possible. Stay tuned.